Good evening and welcome to the August meeting of the Revere Board of Health. My name is Dr. Natalie Kong. I'm the chair of the Revere Board of Health, and joining me tonight are board members Dr. Craig Costanza and Neza Luaudi. Also in attendance for tonight's meeting are the City of Revere staff, Lauren Buck, Director of Public Health, Michael Wells, Director of Municipal Inspections and Health Agent, and Paula Sepulveda, Administrative Assistant. For tonight's agenda, first thing we're going to discuss is the Public Health Communicable Monthly Report presented by Lauren Buck, followed by a presentation from Cheryl Sparra on the legal authority for boards of health. And then finally, we're going to have a discussion on the Revere Smoke-Free Workplace Regulation, specifically a smoking bar exemption. All right, Lauren.
Thanks, Dr. Kong. So I'm Lauren Buck. I'm the public health nurse and the director of public health here in Revere. And I am going to start at every monthly meeting of the Board of Health presenting on the last month's communicable and infectious diseases in the city. So I'm going to start with non-COVID communicable disease monthly report. We had campylobacteriosis, which is a GI causes GI infection. We had 1 confirmed and 1 probable account. For hepatitis B, we had 4 probable cases. Hepatitis C, 3 probable cases. Lyme disease, 4 suspect cases. Babesiosis, which is a tick-borne disease as well, 1 suspect case. And then 3 revoked cases of Group A strep, Group B strep, and measles. And revoked cases just means that they weren't actual cases. They were incorrectly inputted or found out later to be actually not an infectious form. Other important notes that I thought our Board of Health would be interested in: on July 15th, 2021, the CDC had the first confirmed human case of monkeypox in the U.S. It was in Texas. The resident had recent travel from Nigeria, which is where a lot of the other cases have come from. And the other thing that I wanted to bring forward is that the Massachusetts Department of Public Health has identified 14 West Nile virus positive mosquito samples throughout Barnstable, Middlesex, and Suffolk County, where we are. Since testing began this season, this is above average. The contributing factors are increased regional precipitation and hotter than average temperatures. And then finally, our COVID monthly report. This is as of last week. Our positivity rate, our 14-day positivity rate, it showed a slight increase of 0.5%, and our previous 14-day positivity rate was about 0.2%. As of July 27th, 2021, we had 10,896 total cases, 164 total deceased, and our 7-day average case count is 5.7, and that's an increase from our previous 7-day average of about 2.42. If there's any questions, I can try to answer.
I don't have any questions. Anyone with any questions? All right, thanks, Lauren.
Thank you. I'll try to do this every month to keep you guys updated on everything that's going on. Thank you.
Sounds good. And Cheryl is presenting next.
Okay, thank you very much for having me this evening, and I guess I'll say welcome also to you. I had a conversation with Lauren and her colleagues a while ago, and she asked me if I might be able to come in and just speak a little bit about what the legal authority for local boards of health is and what the liability protections are. It's basically a talk that I give when we have our certificate program. We are a membership association, the Massachusetts Association of Health Boards, and we're here to provide legal education and technical assistance to boards of health. Let's see. To move the slides. Do you want to just, is it here? Right here. Oh, perfect. Okay, so as I mentioned, we are a membership association representing the 351 local boards of health in Massachusetts, all of whom have the legal authority to enact local public health laws. And as I said, our mission is to provide technical assistance training and legal education. We do not represent cities or towns. You have a city solicitor who does that. We're just here to provide education and technical assistance, and that's what this slide says. So this is what we normally do. COVID has changed that a bit, but what's happened is that we've basically just gone to virtual conferences instead of in-person conferences. We are able to provide some education on whatever the current legal public health issues are. We have a legal handbook that is available. We just updated it. It's available for free for members of MAHB. We will review draft regulations if you have any regulations that you've created yourself or that someone has proposed for you. We will also create regulations that would, of course, be reviewed by your city solicitor's office, but we have templates for various public health regulations that we're happy to share. And all of this is done pursuant to grants and contracts with the Department of Public Health. So it's at no charge to anyone other than the Department of Public Health, who contracts with us and with other membership associations. So I think I went through this pretty much. The issues that really come before us a lot are enforcement strategy issues, issues surrounding legal authority, and then public health legal issues, and here are just some of them. When we look at the legal authority to enact public health laws, first you look to the federal government, and the federal government actually just provides minimum standards. Most public health work, public health policy and law is created through state statutes or in Massachusetts through Chapter 111, Section 31, which is the law that the legislature used to delegate to boards of health the legal authority to make reasonable public health regulations. You get this authority, you as board members get this authority the same way that police and fire get their authority. It's through the police power to protect the public health, safety, and welfare of the residents and workers in the city. And it is a widely accepted function of government to protect public health, even if there's an expense to individuals' freedom. And I think we have a perfect example this evening with everyone wearing masks. There's frequently a balancing test between an individual's rights and the right to protect the public. And the case law in Massachusetts is really unwavering in that the right to engage in business has to yield to the paramount right of government to protect the public health by any rational means. And you will see, and we'll show you, we'll look at a couple of cases where this becomes crystal clear, but in Massachusetts, our state legislature actually delegated its authority to protect public health to the cities and towns in Massachusetts, and that can be done in various ways that are listed here. In some cases, we share power with the state. For instance, in the sanitary code, in the food code, if a city or town is unable to do some enforcing by the words in the statute themselves, the Department of Public Health could also come in and do some of that enforcing. I haven't seen that happen, but that is, it's within their authority as well to enforce those codes. Most of the time, what the state has done, even in state law, is to delegate the enforcement authority to local boards of health. For instance, in the smoke-free workplace law, the law specifically states that the law shall be enforced by a political subdivision, a health department, a board of health. So it's a state law, but the enforcing authority is the local board of health. And that's typically what happens in Massachusetts. So also, it's important to know that even in Massachusetts, or especially in Massachusetts, state laws are the minimum standards that are required. Cities and towns can go further. They can make laws stricter than state laws. And that's because we have a state that is what's called anti-preemptive. It does not prevent cities and towns from further regulating. That's not the case in all states, but it is the case in Massachusetts. In addition to this broad power pursuant to Section 31 to enact reasonable public health regulations, there are other sections of Chapter 111 that go through specific authority that's been granted to boards of health. And here are just some of them that are listed. The nuisance, Chapter 120, Section 122 and 123 are really important sections because that's the nuisance statute. And the nuisance statute not only permits you to handle nuisances, either to regulate them or stop them, but it also actually requires you to do that. The sanitary code we talked about, and you will see other areas in Chapter 111 that will go through specific authority that you have in these specific areas. This is a really important case. One of the reasons I think it's important just because I was involved in it, but it really is an important case because what happened in this case is that the Supreme Judicial Court actually came up with a really important definition of public health. In this case, we had a Board of Health in Athol who had been struggling with smoking in a private club. Our state law permits, there's an exemption for private clubs where you can smoke in a private club under certain circumstances. What was happening in Athol was that the private clubs were actually operating like public bars. They were advertising, they were letting everyone come in even if they weren't members. So what the Board of Health did at the beginning was to ticket them for violating the smoke-free workplace law because they weren't complying with what the law stated they needed to do in order to allow smoking. Well, that didn't work, and the clubs continued to violate the law. So what the board did then was to pass a regulation that banned smoking in all private clubs in Athol. And the private club sued the town, and we assisted the town in defending that lawsuit, and we ended up before the Supreme Judicial Court, which is the highest court in Massachusetts. And what the court, in their decision, what they wrote is that the focus of public health is to protect the health of every member of the community. The argument that the private clubs were making is that we're private. You can't regulate us because we're private. And when one of the justices asked the attorney for the private clubs, well, you know, what about smoke detectors? We require smoke detectors in a private home. That's a state law. How can we do that? And his answer was interesting. He said, number one, the smoke detector law is not enforced unless you're selling a house. So for some reason, he thought that because it wasn't enforced, I guess it didn't, I don't know what he thought. But then the second argument that he made was, well, that law is put in place so that if members of the public come into that house, then they're protected. So the justice said, so it's not about protecting the kids that are sleeping when a fire starts, that's why the alarm would go off. It's not about protecting them or the other people in the house. It's about protecting a member of the general public. And he said yes. So the court disagreed with him and said we regulate individual behavior all the time. If you look at our helmet laws, lead paint laws, smoke detectors, that it didn't matter that this was a private club. It was a place where people went, and private clubs are regulated from door to dumpster in any event. They need occupancy permits, they need food service permits. So it was a really interesting and comprehensive definition of what public health is. Here are many of the cases, all of which held, and these were all the Supreme Judicial Court cases that consistently upheld Board of Health authority to enact a reasonable regulation. Consistently, they've been upheld as reasonable. Just another case where the court makes it clear that they're not going to step in and substitute their judgment for your judgment. You are the Board of Health, you are the content experts. They're not there to second guess you when you made your decision. As long as your decision was reasonable, they're not going to step into the shoes of an administrative body like a Board of Health. This is a more recent case that happened, and it's also around tobacco control, but in this case, the court upheld tickets that had been issued to a retailer for selling a flavored tobacco product, and the retailer had appealed, saying that, that smelling the product wasn't enough, that the product really needed to go through some scientific testing to determine whether it was flavored. And the court said, no, smelling is what boards of health do all the time. They do it to determine whether a dumpster is big enough for an apartment building, to determine whether milk is spoiled. There are so many instances where a Board of Health used to determine whether a pool floating device is moldy. I mean, there are many, many examples of how boards of health and their staff use their nose. This is the nuisance law, which I mentioned previously. And the reason I mention this is because the charge for a Board of Health pursuant to this law is to examine into all nuisances, sources of filth, and causes of sickness, and to examine things that may cause injury to the public. This is a law that really requires a lot of discretionary function issues for boards of health. And when I was in law school, this was one of the sentences in the textbook on nuisance. There is perhaps no more impenetrable jungle in the entire law than that which surrounds the word nuisance. And here you are getting paid the big bucks to determine what's a nuisance in the city of Revere. And if you determine that something is a nuisance, you have an obligation to get rid of it, to abate that nuisance in some way. However, it is important to realize that activities that are considered generally accepted agricultural procedures are by definition not nuisances. Noisome trade is another area of the law which is very impactful for boards of health. And this law says that you cannot conduct a trade or business which may result in a nuisance or be harmful to the residents or be harmful to their personal estates. This comes up frequently with auto body shops, with nail salons, with truck washing places. And what it permits is it permits the Board of Health to either put conditions on these places or to cite them, to put them somewhere, maybe not in the middle of a neighborhood. But it gives the board some discretion to address issues that could be impactful on a neighborhood. Oops. So I think I've hopefully underscored the broad authority that boards of health have to enact reasonable health regulations and to exercise their discretion. But you it's always important to look at what you're actually considering doing and whether you think that that intervention is going to be effective. And you want to consider that burden to the individual when you're looking at the balancing test. And you really want to think about whether something is fair and reasonable. Many, many decades ago, the town of Brookline wanted to pass a health regulation that banned the use of cell phones in cars. Well, we know that's a public health issue. The state's addressed that issue since that time. But at the time, for it to be a Board of Health regulation, how is the Board of Health going to enforce that kind of a regulation? The last I knew, you don't have cars with sirens going around. You don't have video cameras up where you could see that someone was on the phone. So it was not reasonable in the sense that you didn't have the ability to enforce it, even though it was a reasonable regulation. It wasn't going to be effective. You weren't going to be effective. They were not going to be effective. So the bottom line that I missed is just because you can doesn't mean you should. That's my mantra when we know how much authority you have and that it will be upheld by courts in Massachusetts. You need to think about other factors that are important for the city. So quickly, we're going to not very gracefully go into an next section, and this is the section on the type of hearings that you might be holding as a Board of Health. And there are basically two different kinds. One would be a hearing where you are considering enacting regulations. So you would be acting like a legislative body, actually, in determining whether you want to do that. And actually, in Massachusetts, the only time you're required to hold a hearing before you enact a regulation is if it is surrounding Title V, which is the septic and sewer regulation. Then there's a legal requirement that you hold a hearing. There is no legal requirement that you hold a hearing before you enact any other regulations, but why on earth would you enact a regulation without letting the public have an opportunity to be heard? How do you get buy-in for a regulation if you adopt it with no one knowing that it was even being proposed? So we would strongly suggest a hearing whenever you're looking at enacting or amending a regulation. The other type of hearings are those that are sort of quasi-judicial, when you're holding a hearing to determine whether or not to suspend someone's permit. For whatever reason, or when you're holding a hearing on a nuisance order to cease and desist doing something, and you want the person to come in and explain why they're doing what they're doing and how they plan on rectifying whatever the nuisance situation is. And your staff, not you, but your staff will be involved in other hearings that we won't go through now that involve either the housing court or the district court. Inspections. Your staff will be doing inspections, whether it's a complaint-driven inspection, a complaint comes into the Board of Health, or if it's a periodic inspection. And you get this authority from state and local law. You can't have a regulation or a state statute without the authority to inspect. If your staff is refused access, then you would have to go to court to get an administrative search warrant. You can't just open the door and go in unless you're invited in. So we can go through that in more depth with your staff if they would like to. I think I just skipped a slide. So why do I say we have challenges with enforcement with health departments? Because it's a tough thing to do. And there are different ways of enforcing, and these are the different types of enforcement strategies that exist in Massachusetts. And now that we have our new tobacco law, we have very high fines associated with that law, and that's not our doing. The legislature put fines in that if you sell to someone under the age of 21, first offense, it's $1,000. Second, it's $2,000. third it's 5,000. So the enforcement has changed when it comes to tobacco control now, because we can't issue the tickets that we used to issue because they're only good up to $300. So it's an area where tobacco control staff like yours has had to learn a new way of enforcing. And then obviously the last thing you want to do, but you may have to do it at times, is to go into court. Staffing, you have a city charter, which I'm sure addresses staffing for all health departments, so I'm not going to go through that. There is a state law on staffing that gives the authority to employ staff to local boards of health. However, a city charter can change however the municipal government is created and what its structure is, and I'm sure your city charter addresses staffing issues. So we don't need to go through that. If you're interested in some light reading, here is a manual of laws exists that it's on our website. You can download it. This needs to be updated. The Department of Public Health is in the process of doing that, but it really gives you a pretty comprehensive snapshot of what boards of health and health departments are charged with doing. And just, this is not, somehow. So you will see here, these are just some of the many areas that boards of health are charged with and are actually ordered to enforce. And you will see, you've got disease prevention and control, which we're very well aware of, the sanitary code enforcement, food protection, motels, mobile homes, and nuisances, noisome trades. The list goes on: beaches, water, use of traps, funeral directors. I mean, the list is just very, very long and pretty overwhelming when you really look at what boards of health are responsible for in a municipality. For some reason, this is giving, okay. So what we can do, I think I made it pretty clear what we can do. What we cannot do is provide legal advice or represent a board of health. Just briefly, I want to touch on legal liability because it's something that frequently Board of Health members and staff get concerned about. And I will just say, to move this along, because I know I've been up here for too long, I will just say that the legal liability issues for boards of health are non-existent. If you look at the Mass Tort Claims Act, you will see that that public employers, which are cities and towns, would be liable for any act or failure to act of any public employee who acted within the scope of his or her employment. And believe it or not, the definition of public employer that's clear, but the definition of public employee would include Board of Health members. I know it seems sort of interesting to be using the word employee when you're not paid, or if you are, you're paid a stipend, but for the purposes of the Mass Tort Claims Act, you are considered public employees. And it actually, this is not, I apologize, I'm having a hard time with moving the slides. Keeps. It says the internet connection is slow. Let's see, okay. So we don't need to go through this. This is more relevant for staff, but it's very clear your staff and any of the actions they would be taking would be working on behalf of the city, and therefore they would not be personally liable for anything that occurred through negligence or through failing to act. There are other areas of protection, so that would protect staff and you if you go into a restaurant and inspect and you knock over a vase of flowers that cost, it was from Winston's and it cost $1,000, there would be no liability on the city's part or on the staff's part for having done that. This is a more important additional protection that you have, and this really goes toward Board of Health members themselves. This is protection for any discretionary function that you perform. And the best way to describe this is to describe a case where this was utilized. So I'm just going to go to that case. And it was a case where the city of Lynn was sued by a parent. What happened in this case is that the city built their budget, their annual budget. And when they built the budget, they determined that they were not going to pay for any fencing or snow removal around playgrounds because it wasn't a priority. It wasn't something that they had other priorities that they thought were more important, and they didn't have resources to do everything that they wanted to do, so they made a conscious decision not to do that. A little girl was playing and was sledding down stairs that were covered with ice and snow, and she slid down right out into the street and was run over by a car and was killed. The parents sued the driver of the car and also the city because they claimed the city was negligent in not putting barriers around these playgrounds. And the court ruled that even if the decision that the city made was ill-advised or unreasonable, it had the right to make that decision. It made that decision based upon the balancing of priorities in the city, and it was their decision to make, not the court's decision to make. It was their decision to make. That's a really important exemption. So that, and the reason for this exemption is to stop a monkey wrench from getting in the way of having a municipality work. Because people will say, if you do that, I'll sue you. Boston's health commissioner, who's no longer here, but who's now in LA, used to say, when someone said that, get in line. That's just the way she rolled. But really, I mean, this gives broad protection, and there's a rational basis for giving broad protection. That's different than if you're driving a truck. There's only one way to drive a truck. You can't drive it in reverse. You can't drive it blindfolded. You can't drive it drunk. You have to just drive the truck. And if you're negligent in the way you drive it, that's not a discretionary function. There's also no liability for failing to act, and this is a really important one because this came up in another town where the Board of Health was called to task by the Board of Selectmen because they inspected a restaurant and shut it down because it didn't have any potable water. And the Selectmen called the Board of Health in to one of their meetings to say, look, there's no liability for failing to inspect this restaurant, so why did you inspect this restaurant? That's not the purpose of this exemption. The purpose of this exemption is when your staff gets a call and they need to contact trace 25 people and they can't get to a restaurant inspection, that's okay. That's not, failing to inspect is not grounds for a lawsuit that's going to succeed. And I think this might be the last one. This I put in because it came up during COVID, obviously, and this just provides copious liability protections for vaccination clinics from the planning stage to the cleaning up stage. And it protects, there are two different laws that protect anyone who was involved in running a vaccination clinic. And I think that is all I have. And if you have any questions, I'm happy to answer them. Or if you want me to go home now, I'm happy to do that too. Whatever you'd like.
Yeah, no, that was great. Thank you very much, Cheryl. I don't have any questions. Anyone? Okay. Okay, we will certainly let you know if any come up. That was just a lot of information. All right, so let's, in the kind of interest of time, let's move on to the final agenda item for the evening, and that is the smoke-free workplace regulation and an exemption for that. Yeah.
Good evening, Madam Chair, Dr. Kong, Dr. Costanza, Ms. Luati, I apologize if I pronounce Luati. Thank you. My name is Chris Kreidler. I am an attorney with D'Ambrosio Brown at 14 Proctor Ave. We represent Mr. Moed Abugala, and is probably better known as Saber to many members of the community here in Revere. But we are actually here just as proponents of the amendment that the mayor is putting forth to add with the potential of a cultural exemption to the workplace smoking restrictions that I believe were put in place in 2004. And just to allow for one smoking bar that for the purposes of smoking hookah or shisha. Now, the most believed practice of smoking shisha or hookah started 16th century India or northern India or southern Persia. The practice subsequently gained popularity throughout the Middle East, and it was initially reserved for royalty or the more affluent. It has since become more accessible to the masses, to the extent that shisha cafes are commonplace throughout much of Arab culture and much of the Middle East as well, not to mention through India and Southern Asia as well. Now, shisha is predominantly enjoyed as a group or communal social activity. It provides a casual meeting place for adults to gather, relax, and socialize. That it's somewhat akin to, in Western culture, just meeting at a bar and just having the opportunity just for that communal relaxation, that societal aspect, and just being able to connect with other people. Now, a shisha or a hookah lounge, however, would also cater to those who choose not to drink or who cannot go to the bar, but would like the similar social atmosphere. Now, Revere is home to a diverse array of cultures, including many from parts of the world where smoking shisha or hookah is very commonplace. A hookah cafe or lounge in Revere would provide those members and new members who come to this community with a small taste of home. The allowance of a hookah or shisha cafe within the city of Revere would also assist in welcoming and including members of growing minority groups to the city as well. Now, Mayor Arrigo is supportive of an amendment that would allow the cultural exception to the workplace smoking regulations, with the hope that specifically a hookah or shisha lounge would be introduced to the city. Other members, I believe, of the Six City Tobacco Initiative, I believe it's Somerville, Cambridge, and Everett, have also allowed exceptions to their workplace smoking regulations that would allow smoking indoors at either a smoking bar or retail tobacco shops. Now, obviously, part of the reason that we're here today is that Mr. Abugala would also like to be the one who would have that opportunity to open a shisha or hookah lounge. He has the space ready. He's already a well-standing member within this community. He's already licensed to sell tobacco, and is willing to work with the city, work with the Department of Health, and the Department of Revenue, obviously, because he would need that smoking bar permit to even open in the first place, to ensure a smooth and safe operation to open his hookah lounge. The property right now is small. I believe you said that it would seat a total of 18 people. 18 people. The employees would be comprised of Mr. Abugala and likely family as well. No alcohol would be served. This is not a bar. This is not it's not an establishment. I believe you had indicated the hours would close 10 or 11 o'clock at night. I believe that's something that he would also work out with the Board of Health as well, if permitted to do so. And it does also have off-street parking. Mr. Abugala is actually the owner of the Good Diner down the street as well, which has its own parking lot, which you would predominantly use. So we humbly ask that the board consider
Like people watch soccer, watch sport, you know what I mean?
Just that social atmosphere, just kind of allowing folks of
People doesn't go
Middle
to
Eastern
bar,
culture
doesn't go
or
to club, we wanna go, like, meet together in a lounge, you know what I mean? People like doesn't go to bar, doesn't have alcohol, doesn't drink, come and have a like Coca-Cola, soda, whatever, and it's no hookah, that's it.
so
There's no bar at all, nothing.
we would appreciate your consideration in adopting the amendment that would allow, at least for the time being, just the one hookah lounge for the one exception for cultural purposes, and allow Mr. Abu Ghalala to open the hookah lounge on Winthrop Ave. So happy to answer any questions, I believe.
Yeah, it does say here in the motion to amend that it will be no greater than 3 smoking bars.
I'm sorry?
It says, but I'm looking at the motion to amend, it does say in there, like number 5, there, you would allow no greater than 3 smoking bars within the city of Revere, but you're just asking for.
We're just asking for
the
one at this
Okay.
point.
Well, I definitely appreciate you guys coming up here, and I do appreciate being a PCP in this community. I appreciate the diversity that Revere offers and its residents offer. So I do think it's important for us to definitely hear you guys out. We hear you loud and clear, and we want to be in line with the mayor in supporting everyone from all races, cultures, creeds, et cetera. I think what we're going to be deciding today, though, is whether to have an open hearing, because it sounds like, what we should do before enacting or regulating any sort of laws is just having an open hearing, because we do want to make sure we're getting opinions from the entire city, or as many city members who have a stake in this as possible. So I think that's going to be the decision we're going to come to this evening after some discussion. Correct me if I'm wrong, Cheryl, but that should be probably the next, I guess, phase in trying to amend the workplace smoking restriction for the city of Revere.
What would normally happen is that the board would draft an amendment and it's an old regulation, so you may want to look at some other things in the regulation as well, but you would want to have a draft ready with, you could throw in everything, add an exemption for smoking bars, you could change some definitions, you could do whatever you wanted to do, but you would have a draft regulation, and we're happy, we have templates on all of secondhand smoke regulations. And then you would hold a hearing and get input from the public, but you would also want to make sure the city solicitor looked at the draft. We frequently are a little concerned when you're allowing one, what happens if somebody else wants.
Yeah.
Usually it's more than one.
Yeah, it says here 3, so.
You could put a cap on the number, absolutely, but the concern is when it's just one, will that present more of a challenge for the residents and the business owners if it's just one? But that's something the city solicitor would decide. So then you would hold a hearing, and after the hearing, you may want 2 hearings, you may just need 1. Then you would deliberate, and you would see, after you receive comments, you would determine whether you wanted to change something else in the draft as a result of the comments that you received. And usually at the next regularly scheduled meeting, you may do the deliberations. They have to be done in public because of the open meeting law, but you would deliberate and then you would vote as a board whether to amend it and how to amend it and what the effective date of the amendment would be. So that's normally the best practice for amending a regulation. Again, you have the legal authority to do it right now, but having no input and no review by the city solicitor and no draft in front of you, that's a very challenging way to work, and it presents more problems than it solves. So it's better if everyone's informed and you have a working draft in front of you that everyone can comment on. Can read and can comment on and make suggestions and just have an open and transparent process.
I think it makes a lot of good sense. I guess we should deliberate, on whether to sorry, well.
No, it's just wanting to emphasize that no alcohol is going to be served. It's actually not a bar, it would be a lounge. The definition right now, it is technically a smoking bar, but no alcohol would be
That's
served.
why our people come from.
Yep.
Gotcha.
And
Okay.
that's predominantly why, for the cultural exception as well.
Okay, great.
And I believe in the draft that Dr. Kong, that you received, does it include language as well, or proposed language?
So, language regarding what?
The definition of smoking bar, or just a
Yeah.
proposed
Well,
additional language for
Yeah,
it,
section C.
However, given the age of the regulation itself, I would imagine that you'd want to review the entire thing as well. So that makes sense.
Yeah, but yeah, I mean, I guess we can, start to deliberate on whether or not you want to have an open hearing about this. Any thoughts?
And we'll sit down. Thank you.
Oh,
very
yeah,
much for your
yeah, you don't
time.
have to stand up for this. Any thoughts? Y'all, what do you think, Neza? You should do it, yeah? Yeah. Yeah, yeah, oh, you might want to put your speaker on. Yeah, push the button, right here. Yeah, and then when it's red, it's on, it's a hot mic. Yeah.
Yeah, I think we should just, like Cheryl suggested, we do a draft and then
Yeah,
and then have an open hearing
yeah.
to have to get more people, to get more ideas and stuff. And
Yeah. I mean, being a primary care doctor, my immediate concern is obviously the high smoking rates in the city already. I think before COVID happened, it's hard to imagine a time before COVID, but I remember Juul was a big thing, and vaping in our schools was a huge problem. So that was just kind of the biggest concern to me. I think a lot of folks do think there may be a myth that maybe hookah or shisha is a little bit safer, but there's data to support that it's not safer. Having said that, alcohol is also, right? Like it's also, well, it's not going to be a bar, but just as an example, right? Like that's legal. That's legal, and smoking isn't illegal, but, there is data to suggest that in Revere, we do have a much higher prevalence of smoking than the state average. So, that is something that is kind of, in the back of my mind. But like I said, I'm totally open. I am also personally open to just having a bit of an open hearing, but that is a concern that I have, is just the rates of cigarette smoking in Revere as compared to the state is just much higher overall. What do you think, Craig?
I think given that there's such a cultural tradition with this that went back to, 15th century, there's probably more of a diverse issue with this than, that would make it more of a gray matter area than just completely black and white. So I would be up for a hearing.
Yeah, okay. So I guess it's decided then. I'm also open for hearing, so it's unanimous. We'll plan to, I guess, have our solicitor write a draft amendment, and then we'll have an open hearing.
yeah.
Whatever information, and again, the city solicitor is the last, his department makes the decision, not anyone else, to reviewing of the legal document itself. But I'm happy to draft it, in essence.
Yeah, that'd be great. Thank you, Cheryl. Alrighty. All right, well, I don't think there's anything else on the agenda for this evening, is there?
Anyone else like to speak?
You guys don't want to speak?
All right, well, I guess we're all done.
Motion to adjourn.
Second.